Do you have thyroid problem? Along with the thyroid, are you struggling with a long-term acidity? If the answer is yes, then stay tuned with me because today I'm going to discuss few of the most common reasons which can give you the acidity. What are they? Let's find out. Namaste. My name is Dr. Tanvi Mayur Patel. I'm an endocrinologist, hormone specialist doctor from Mumbai, India. Acidity, also called as an acid reflux, is a very common symptom, and it is a symptom which is very disturbing because throughout the time you feel you uneasy. Okay, people can have a varied kind of a symptoms ranging from a heartburn to burping to belching the food. Sometimes you can have a chest pain, indigestion, and these are not very pleasant symptoms. And most of the time, if you have a one-time acidity, there can be a reason you have a multiple daily such events. And that is a reason where a person needs attention. Most of the time, people believe that the acidity is due to more acid secretion. That may not be true when we are especially talking about the thyroid. Lot of times, if your acid level is imbalanced or it is low, or if the acid is absent, that can also give you the symptoms which are very similar to the gastritis symptoms. Okay, I'm going to tell you few of the most common reasons why a person with the thyroid develops such acid reflux symptoms. The very first one is the food sensitivity. Yes. Food sensitivity means certain kind of a food your system or your body does not agree to. Okay, and people who have a thyroid problem usually have a food sensitivity with the 2 to 3 food products. First is the gluten. It's a protein present inside the wheat which is a problematic. Second one is the dairy products. The protein lactose is also problematic to a lot of people. And the third one is the sugar. All of these food products, if your body is a hypersensitive or sensitive, you will get acidity. Okay. Second reason is the low stomach acid. Yes, the stomach acid which is secreted inside the stomach by the gastric cells. Okay, this pH of your stomach has to be in a certain level so that all the absorption and the digestion happens well. But if for any reason, if your stomach does not have sufficient pH level of the acid level, you will have symptoms which are very similar to gastritis. If the food pH or if the pH inside your stomach is around 3, that means that there is a low stomach acid. And a low stomach acid is a lot of times responsible for many gastric issues. Okay, the disease like IBS, irritable bowel syndrome, peptic ulcers, certain gastric cancers can also be related to the low stomach acid. Okay, lot of time people think that the acidity is due to hypersecretion, but it can be also due to the low secretion, what we call it as a hypochlorhydria in a medical language. Okay. The third reason is the gut motility. Okay, and if your gut motility is slow, then this is the problem. See, when we eat food, what happens? There is a peristaltic kind of a movement which happens inside our digestive system, which moves the food further. When you have a thyroid problem, especially the hypothyroid, and if not well managed, the motility is a slow. And what happens due to that? Because of the low food motility, the food stays inside your system for a long period of time. And because of this, food which is collected in your digestive system can move up towards your esophagus area and can trigger the lower esophageal sphincter. And that can also give you the acidity. So, slow digestive gut motility is also responsible for that. Another reason is a small intestinal bacterial growth, what we call it as a SIBO. Lot of times, the reason for the acidity and a thyroid is a small intestinal bacterial growth. What does it mean? As the name suggests, the bacteria is overgrowing inside the small intestine. Many times, even the migration of the bacteria from the colon to the small intestine can also contribute to small intestinal bacterial growth. And this creates an imbalance of the gut bacteria. This we call it as a gut dysbiosis. And if you have a gut dysbiosis, then also you can have an acidity. Lot of times when you have a gut dysbiosis, lot of food ferments inside your system. And if the food is fermenting, lot of gas is created. And if the gas is created, again it will put pressure on your esophageal sphincter and can give you the trouble. Okay, so these are the certain reasons. Another reason is a stress. Yes, the more the stress, the more the acid issue. Why like that? Because when we are under stress, okay, we are under the sympathetic stimulation. And the sympathetic stimulation makes the digestion as a least priority. That is not the time for your body to prefer digestion as a priority. It is a time when your body is fighting. It's a flight and a fight response. So when you are under chronic stress, the digestion becomes your least important. And a chronic stress we all encounter in our day-to-day life. Acute stress is okay, but when you're chronically stressed, your digestion is majorly affected, and that's what causes the acidity. So if you have acidity, cut down on your stress. When you cut down on your stress, again you're going from sympathetic to parasympathetic stimulation, where digestion becomes a priority and you don't land up with the acidity kind of a symptoms. Okay. Another reason is the excess usage of a proton pump inhibitor. Now, proton pump inhibitors are the medications which you mainly use to suppress the acid secretion. But as I told you, unnecessary, if you are going to take these medications, then you can land up into proton pump inhibitor related acidity issues. And one more reason is eating a spicy food. Yes, if you are eating very spicy food, which is difficult for your body to handle, again, you can land up with the acidity. And the last and not the least is a infection. Yes, some hidden infection lying inside your gastric mucosa can also give you this problem. And one such very common infection is a H. pylori infection, which is a bacterial infection found in 50% of the general population, and unfortunately 80% of them are not having any symptoms. This H. pylori can give you a long-term acidity which is not suppressed by any of the medications. And it is this H. pylori can also contribute to the thyroid problem. How H. pylori and thyroid are connected, I have made a separate video for that. If you want, you can watch that video. You will get more knowledge about that. Alright. So these are the common reasons why a person with the thyroid can develop acidity. Do you have acidity? Please write in the comment box what is the cause of your acidity. Okay. If you don't know your cause, then just write acidity in the comment box. I'll try to help you out. Alright. I hope this video helped you a bit. And if you got some good and useful information, please click on the like button. And if you are new to my channel, don't forget to subscribe. Your subscription gives me encouragement to make such videos so that I can present such interesting topics in front of you. And if you want to consult me, my clinic is in Mumbai, India. You are most welcome to visit my clinic. If you want, you can also avail an online consultation. And for that, I'm giving you one contact number which belongs to my staff and it's not my personal number. If you want, you can reach out on that number. The number is India code +91 and the number is 9987829999. I hope to see you soon in our next video. Till then, you take care of yourself. Namaste.